Okay, so here's a little video on how to use the pulse oximeter. Okay, so if you remember, this is the device that measures the oxygen saturation in the blood. Okay, so what you would have wanted to do is that you would want to cleanse it with alcohol, just a quick little wipe inside and out. I don't know if you can see it, but there is a little like laser inside of there. My little nail is pointing to it right there. And it's just a little infrared laser that goes through your finger and measures the oxygen saturation in the blood. Okay, so what you do is you turn it on, okay, and then it says the SpO2 percentage, and it also gives you the pulse rate. But we don't go by the pulse rate on the device. We always use a manual, we take it with our hand. But let's do it for the pulse ox. So you're gonna put your finger in there, you push on. Okay, normally you'd want them just at a heart level, like on a table, but for viewing purposes, I'm holding it. Right now it's beeping at me, or it was beeping at me because my pulse was a little high, but now it leveled out at 85. So let me try to turn it. I don't know how well that's gonna work. Here. But basically it's saying SpO2 at 98%, and it's saying my pulse is kind of waffling between 99 and 100, which is normal. When we hear this beep, see it's beeping right now, is because it goes over the 100. Usually when this goes below 95, it starts to beep at you as well. Okay, so when we have the pulse ox on our patients and it's 95 or lower, you do want to check the temperature of their hands. They might be cold. And you want to instruct them to take a deep breath in and out, in through the nose and out through the mouth, kind of like a. Do that a few times. We say smelling the roses and blowing out the candles. This gives you a little bit of more bang for your buck when it comes to oxygen. Okay, so I don't know if you saw that, but I went up a point just by doing one breath. So that's pretty cool. And then you just take it off, turn it off, and then you would again just cleanse it with alcohol, okay, and let it dry. And that's it. That's the pulse ox. When we document our pulse oxygen saturation rate, we always document it as percentages. So 98%, 100%. Okay, so that's pulse ox.